Good morning, good afternoon, good evening, ladies and gentlemen. I'm Tiejun Tang from London, United Kingdom. The topic I will report today is anti-COVID-19 pandemic under the guidance of the Professor Deng Tietao's academic thought. General introduction. Professor Deng Tietao was appointed as the leader of the SARS expert group in 2003 by the National Administration of Traditional Chinese Medicine. Under his guidance, the first affiliated hospital of Guangzhou TCM University achieved 4-0 on the treatment of 71 cases of SARS, which is 0 mortality, 0 hospital transfer rate, 0 sequelae, and 0 hospital infection. Patient's body temperature back to normal within 3.26 days. Due to the extensive intervention of Chinese medicine, SARS getting under control in about 3 to 4 months, Professor Deng contributed his prescription for SARS treatment. To analyze his prescription for anti-SARS 18 years ago will give us a high value of reference for the treatment of COVID-19 today. This prescription is from Professor Deng. We can see that is his signature, and the date is 2003, 18th of April. The important commonality between the SARS-CoV-2 and the SARS-CoV was found. A recent research report showed SARS-CoV-2 used the SARS-CoV receptor, ACE2 receptor, for enter the cell. These two viruses are very similar. The symptoms they caused also similar. The reaction to the treatment should be similar. Look at this picture, and this is SARS virus. This is COVID-19 virus. They looks very similar in the structure, and they all enter the cell through the same receptor, which is ACE2 receptor. Original report published in the April last year. The prevention and treatment method. According to Professor Deng's clinical experience, I made a formula of modified Yupingfengsan tablets to prevent COVID-19. On the March of last year, when UK only have a few cases, all my patients and their families began to take these tablets for prevention. The ingredients is classical Yupingfengsan, which only contains 3 ingredients: Baizhu, Huangqi, and Fangfeng. Because the COVID-19 pneumonia is located in the lung, so I add 2 herbs for clean the lung heat, which is Huangqin and Sangbaipi. Another 3 herbs for antivirus. First is Banlangen, and then Li-zhihe, and then Qinghao. These 3 herbs for antivirus. I will explain why I use these 2 ingredients. Yupingfengsan has been widely used to prevent disease since Yuan Dynasty. Different from the traditional Yupingfengsan, Professor Deng used Baizhu as the biggest dose. The dose of the Baizhu is equal to the Huangqi plus Fangfeng together. I select Li-zhihe is because it can inhibit SARS virus. It was approved by the laboratory research in 2008. You can see the published paper in this magazine. Artemisinin is an active ingredient of Qinghao. It has been thought to have the inhibitor effect of the variety of the virus. This paper was published by Thomas at 2008. He is a doctor and researcher in the Guy's Hospital in London. The treatment method: about 40 cases of the COVID-19 was treated by herb decoction. All the patients have online consultation. The herbs was sent to patients by post or collected by their families. This case including 10 cases of remote consultation with my colleagues in Europe and Canada. The formula selection: at early stage, if the patient is due to wind cold and wind damp type, I select 经防败毒散、九味羌活汤 and 杏苏散。If the patient is symptoms is due to the wind heat or lung heat, I select 银翘散、桑菊饮 and 桑杏汤, modified from these three formula, which come from Wu Jutong from his book of 温病调变. I found in the early stage of COVID-19 more wind heat than wind cold, especially in UK. Mostly the patient have wind heat syndrome. More chance to select the formula from 温病 master Wu Jutong, 银翘散、桑菊饮、桑杏汤 and 杏苏散, all from Wu Jutong. At middle stage, I would like to select 小陷胸汤. That is the formula from 伤寒论, and only 3 ingredients: 黄连、半夏、瓜蒌, and also 葶苈大枣泻肺汤, 苏子降气汤 if the patient have more asthma, and 三子养亲汤. For severe case, I use 生脉散, which come from 伤寒论, and 四逆汤 also from 伤寒论, and 独参汤 sometimes. Generally speaking, is combine the prescription of 温病 and 伤寒, not only use 温病 or 伤寒. The treatment result: the prevention result. After the modified 玉屏风散 treatment for 2 weeks, only 1 case was infected. In 60 patients, the infection rate was 1.66%. The treatment result: according to Professor Deng's treatment principle on the SARS, I treated 40 patients. All were cured. The mortality rate is 0. Next is a case report. This case is a lady at 76 years old. She's Asian background, and initial consultation is 8th of April 2020. Chief complaint is the difficult breathing for 1 month. The patient has been diagnosed of COVID-19 and stay in the ICU of the hospital. And after the treatment, her body temperature back to normal. Even the virus already returned to the negative, but her breathing getting worse and more difficult to breathe. And combined with the palpitation, fatigue, and night sweat, doctor told the patient's family is the worst prognosis. The doctor said they can't do anything, maybe just let the patient peacefully die. But patient family didn't give up. They found me through their social media. And after the online consultation, I gave a TCM diagnosis is asthma due to Qi and Yin deficiency. Western medicine diagnosis is COVID-19, respiratory failure. Treatment principle is benefit qi and nourishing the yin, descending the qi and release asthma. The prescription, I select modified 生脉散 plus 三子养清汤. We all know 生脉散 only 3 ingredients, 太子参, 麦文冬, and 五味子. 三子养清汤 is 苏子, 来附子, and 白芥子. I also plus 沙参 for masking the lung yin and 玄参, 知母 for clean the heat. And 青蒿、荔枝核 and 百合. 青蒿 and 荔枝核 for antivirus. 百合 and 甘草 for benefit the lung and release cough. Give patient 7 bags, 1 bag per day. Follow up. The patient started taking the medicine at 11th of April. Only second day, all the symptoms getting better. Her heart rate reduced, blood oxygen level increased, tongue from the cremotion to red without coating. At 18th of April, the symptoms continue to improve. A repeat prescription was given. At the 21st of April, patient didn't receive her herbs because delayed by the post office, and her decoction stopped for a couple of days. All the symptoms getting worse again. The patient lost appetite. I added huang qi 20 grams and 麦芽 and 谷芽. Tell patient families to collect the medicine from my place. And after a few days, patient feel much better again. The heart rate reduced and the blood oxygen continued to improve. Appetite came back. I removed the 玄参 and 知母, added 款冬花 10 grams and 白术 10 grams. At 5th of May, the patient continued to improve. I gave a repeat prescription, 7 bags. At 12th May, patient was discharged from the hospital and back to home. Reduced oxygen intake. Her blood oxygen level keeps improving. A repeat prescription was given, 7 bags, take 1 bag for 2 days. That is a reduced doses. At the 23rd of May, only heart rate is slightly rapid. Feel a little short of breath after exercise. And tongue was slightly dark with a white and thin coating. I gave a repeated prescription and for another 7 bags and 1 bag for 2 days. After 1 year, she came out from the hospital, and I gave a follow-up through the telephone, and the patient is basically normal, very healthy, stay at home. So she's still very healthy so far. Look at, this is the tongue picture. This is the first time, 8th of April, and a few days later, at 12th of April, you can see the tongue is some improve. And 27th of April, a little dark color. And 23rd of May is already have some tongue coating turned up. And that is oxygen intake from the 6 liters per minute reduced to half liter. At the moment, she didn't need oxygen anymore. And the heart rate from the 120 gradually reduced to 90 and 92. And the blood oxygen level from the 86 gradually increased to 96%. Discussing. In the 1998, 5 years before SARS, Professor Deng already told us Wenbing is important in treating the viral infectious disease. He had written, Wenbing originated from Shanghai, but it gradually developed from Shanghai. The effect of Wenbing in the treatment of infectious disease, especially viral infectious disease, are still keep ahead of the world. This is not an overstatement. 5 years later, when SARS arrived, Professor Deng's prescription was based on Wenbing's classic formula, 桑菊饮 and 三仁汤. Let's analyze his prescription. The treatment principle is clean the heat and detoxification, expel the dampness and disperse in the lung. Clean the heat and detoxification by this medicine. 桑叶、野菊花、青蒿、金银花、蒲公英 and 薄荷 and 甘草. All of these has function for clean the heat and detoxification. For expel dampness and dispersing the lung, he used 杏仁、薏仁、冬瓜仁 and 白茅根、藿香、桔梗、桃仁. Original 三仁汤 here is 白蔻仁. He used 冬瓜仁 to replace 白蔻仁. He used 白茅根 to replace 芦根 in the 桑菊饮. I think if he's still alive, he probably will still give this similar formula to COVID-19. The three formulas and three remedies recommended by Chinese government for anti-COVID-19, they are good formulas, but unfortunately, some ingredients are not allowed to use in outside for China because it contains 麻黄、石膏、细辛、紫苑. For different reasons, these ingredients are not allowed to use in UK and most of the EU country and the US. Professor Deng's modified 桑菊饮 didn't contain above ingredients, more suitable to the overseas patient treatment. Conclusion: COVID-19 and SARS are very similar viruses. Professor Deng's clinical experience on SARS is valuable reference on today's pandemic. A modified 桑菊饮 and 三仁汤 should be selected for COVID-19. Under the guidance of Professor Deng's idea, my treatment and prevention showed a satisfied result. Unfortunately, the number of the patients are too less. A large sample of RCT still is needed in the future. Thank you very much for your attention. Thank you.